The Industrial Revolution of the 1800s caused an increase of wealth and growth of the middle class that created huge opportunities for new public health changes. Not only were new technologies quickly developing, but scientists started discovering the role of infectious microbes, understanding germ theory and how to prevent these kind of infections. Scientists figured out ways to increase the safety of drinking water, designed flush toilets and systems of trash removal, and as antibiotics entered the scene, life expectancy leveled off in developed countries. Scientists began to learn the importance of affecting the environment and learned that lifestyle plays a major role. Those daily health habits were very important. In the mid-1900s, there was a major study breakthrough understanding how lifestyle plays a role, and that was the Framingham Heart Study. This followed about 5,000 residents in Massachusetts to see what kind of behaviors and other risk factors predicted heart disease, stroke, and other kinds of future ailments. Over the next 20 years, this longitudinal study of these 5,000 residents made it clear the role that behavior played. This was where we get the ideas of how smoking and eating can affect heart disease. And with this knowledge of the changes in lifestyle that could affect, it came into our mind that we could prevent disease, not just treatment. And this focus on prevention remains big today. The 20th century also saw a beginning to focus on the social nature, the interpersonal nature of illness. That is, how do people act when they are sick? What role do they take? And what kind of rights do people have when they're sick? Should they be allowed to not go into work? Should the government take care of them in some way? And as there was more focus on who was getting sick, we noticed that the interpretations and reported illnesses varied by culture. We started understanding an increased diversity of Western population, so now we're seeing sociocultural development and sociodemographic forces that are a part of health and illness. For instance, psychologists such as Richard Lazarus and Susan Folkman discovered that even how people appraise or evaluate something as stressful can have an impact on a health response. The scientist George Engel also suggested that people have certain dispositions toward illness, specifically that some people were more likely to perceive and report illness than others. In the 1970s, research also suggested that the brain can affect motivation and learning and vice versa, opening the door to research on biofeedback, placebo effects, relaxation training, and plenty more. Simultaneously, there was a growth in the idea of psychoneuroimmunology, the idea that the brain and our neurological patterns can affect physiological and immune functioning. Together, all of this research demonstrated the importance of integrating the biological, psychological, and social side of things, both conceptually and empirically, and this has really become the basis of the health psychology perspective. It has led to what is known as the biopsychosocial model, the conjunction of biological processes, psychological processes, and social processes. This was in contrast to the previously understood biomedical model, only looking at interventions and how to treat specific diseases. This biopsychosocial model mandates that scientists consider both the macro and the micro level processes, that is, needing to understand the individual and how their body is functioning, but also looking at the macro level of the society, looking at not only chemical imbalances and physical ailments, but also social contexts such as systemic racism, access to food, availability of medical treatment. And this new value placed in understanding people through a biopsychosocial lens led to a rapid growth in this new field of health psychology. In 1978, health psychology was established as a research field, and in 2001, the American Psychological Association added the quote, promoting health to its mission statement. So just 25 years ago, health psychology didn't exist, and now it is a driving force. As health psychology grew, it defined itself as the scientific study of psychological processes related to health and healthcare. In that regard, health psychologists can exist in really any field as long as they are applying what they know to bettering people's mental and physical well-being. And throughout it all, health psychologists are focused on rigorous scientific methodology, developing their conclusions from real data and real investigation of these biological, psychological, and social phenomena. But you may be asking yourself, why now? Why would this increase in public health and antibiotic use and decreases in infectious disease? Why is health psychology so important? To answer that question, let's take a look at mortality just 100 years ago. This is a chart of the deaths per 100,000 people. And as you see, infectious diseases made up over half of that. Illnesses caused by these infectious diseases are generally known as acute illnesses. They are short-term, often viral or bacterial in nature. But if we now fast forward to 2010, we can see that mortality has decreased, but the things that are killing us have changed. Now we're seeing more of what are known as chronic illnesses. These are long-term development typically managed rather than cured. And there's an important distinction between this acute and chronic. And that is that the psychological and social decisions that we make in our lifestyles play a major role in our exposure to and our treatment of these kind of illnesses. Prevention begins way before the illness does. And that is where health psychologists come in.
This is a test. This is a test to see how it feels.